We will also be streaming this webinar live on Facebook, or we are streaming it live on Facebook, and later on the video will be posted on our YouTube channels. So this webinar will be available for even those for the persons that might not be on the Zoom. At this moment, I know we have the key panelists with us. We are waiting for one person to join, but we'll be able to kick off. I know we have the organizers of this panel, of this webinar, the African Coalition for Corporate Accountability, which is basically a 136 member organization that brings together different civil society actors on the continent working around business and human rights and corporate accountability. And this webinar basically is a first in a series of a number of webinars that deals with General Comment 7, but also deals with obligations of state to regulate private actors involved in the provision of social services, which is going to be a main theme at the ACCA conference before the General Assembly later this year. We are also partnering with the Initiative for Social and Economic Rights, who is a member of the ACCA, but also hosting the General Assembly this year in Uganda. And the initiative works ACCHR works towards the full recognition, accountability, and the realization of social and economic rights, primarily in Uganda, but also within the African region, and has been working on issues of social service delivery, and was one of the 66 civil society organizations that welcomed the publications of the General Comment. And ACCHR's research has found a detrimental impact on the poor and vulnerable when states fail to effectively regulate private actors. So this is a key framework that is going to help, or is geared to help towards protecting vulnerable communities when it comes to access of social services. As noted, the Center for Human Rights is also part of the partners from the University of Pretoria, and has worked tirelessly towards issues around social and economic rights, but also combining academic excellence and effective activism to advance human rights on the continent, and also lead a leading human rights institution when it comes to strengthening capacities of civil society actors, but also duty bearers and legal practitioners on various issues to do with human rights on the continent. Lastly, we have the Global Initiative for Economic, Social, and Cultural Rights, whose mission is to transform power relations to enable every person and community to enjoy their economic, social, and cultural rights and all other human rights. So these four main partners are working together to organizing this webinar, but also a series of other activities towards effective implementation of General Comment 7, including for meetings or civil society forums at the NGO forum, or forums or meetings at the NGO forum during the African Commission that will be had, and will be informing the partners when those are due. So at this point, I know it's a bad time for different reasons, because in Uganda it's lunchtime, in East Africa it's lunchtime, in West Africa it's basically morning, and in Southern Africa it's midday. So it's a lot of different time zones and people joining from different areas, but we will try to keep time, but also try to ensure that we give breaks where necessary. For those still joining, we have interpretation services, so please use the button down on interpretation on the Zoom links to access this. But at this point, I will welcome Professor Franz John, who is the director of the Center for Human Rights, to give us welcome remarks, but also say a few words concerning the General Comment 7, but also the overall objective of the webinar as we start this webinar discussion. Professor Franz?
Thank you very much, Arnold, and good day to everyone, wherever you are. Welcome. We are very pleased that you are able to join us. I want to say in particular, thank you to all involved in putting this webinar together. And I want to, in particular, also thank our partners. I think Arnold has mentioned the names of the various partners in setting up this webinar. I want to emphasize, though, that ACCA, the kind of coalition with its membership, is celebrating 10 years of its existence, and that this webinar is also part of ongoing attempts to not only expose General Comment 7 to wider scrutiny and sensitization and awareness, but also to celebrate and to give voice to the partners and the activities of ACCA in this particular year. So thank you very much to everyone. I think it is a common knowledge to all of us that the African Commission in 2022 adopted and launched this general comment looking at the regulation by states of private actors that are involved in the provision of social services. It is important, I think, to note that in developing this general comment, the partners in this webinar were all very much part, together with a few others, forming the core of the drafting group that had really done the heavy lifting in the preparation of the draft general comment. It took about 2 years. It was in the middle of COVID that the drafting of this process started. It was a complex process that entailed many meetings, virtual meetings, and eventually an in-person validation and discussion. In Pretoria, the center was very glad to have played a part in facilitating that process together with our partners. But I think the that general comment number 7 was adopted as a soft law instrument. The general comment really relies on the African Charter, on the jurisprudence of the African Commission in cases, in communications decided, but also in other soft law instruments, but also
Yes. Hello.
Hello, Arnold.
Hey, it seems we lost Prof. France. I thought it was at my end because I think the service was unstable, but we seem to have lost him.
Arnold.
Can you hear me? Hello.
Arnold.
Yes.
Yes, I was saying I think it's the Wi-Fi on campus. So
okay, so I'm sorry, that was a power outage here in South Africa. I don't know if I should just in one sentence conclude, Arnold. I think I was.
Yes, Prof, we lost you for about 2 minutes, so you can maybe just conclude your remarks and then we start. Sorry about the power cut.
No, it's unstable. It's unstable.
Yeah, we can hear you now.
Yes, just then to say, I mean, to have soft law instruments is one thing, but it's about soft law is persuasive, and it is our task to cultivate and reinforce the persuasiveness of this general comment. And I think that is what this series of webinars aims at, and this webinar in particular today. And I think the persuasion comes from the quality of the document, which we hope is clear and further. And also comes by relate this to the charter, link it to the charter, but show how the charter does not cover this particular issue, and that makes the general comment pertinent also to states to whom it is directed. But I think it is also to draw the link to the ongoing need for the general comment to highlight issues of practical concern in Africa. And I can just think in South Africa, we recently had the very pertinent illustration of how a lack of regulation can have negative consequences. And that concerned privatization of prisons, which I think in the broader sense is very related to General Comment 7. We've seen that the lack of regulation by the state had caused corruption and mismanagement and other consequences that are now being fleshed out through media. And I think we can look very broadly at the various practical, real situations in Africa that are ongoing, to whom the flesh, to the kind of bones, if you like, of General Comment 7, and related increasingly to practical situations, showing how it gives us ammunition and enhances our thinking and give us tools and give us a pathway to engage states on the lack of regulation and the atrocities that may arise from private actors entering into social provision and not living up to the expectations that we as the people of Africa may have. Thank you very much once again to everyone. My apologies for falling off because of the blackouts here in South Africa, which I think in itself has a story for us that is relevant to our discussion today. But I leave it at that and wish us all a very fruitful conversation around General Comment 7. Thank you very much, Arnold.
All right, thank you very much, Prof, for basically setting the stage of this conversation, but also giving insights on exactly why this general comment is very timely and also relevant to the practical realities that we are dealing with on the continent. So at this point, we will be able to jump into the discussion, but also understanding that this general comment was really is not the first that really set the course of the conversation when it comes to issues around private provision of social services. And as our program sets, I know we are already eaten into some of the time, we will be turning to Ashina Sumi from the Global Initiative for Economic, Social and Cultural Rights, who will basically give us a broader overview of the general comment, number 7, but also it's, diving deep into the scope, content, and objectives of the general comment to kind of also give us a bit of more a platform to have further conversations with the different panelists on exactly the more practical implications and how effective we can use the general comment to ensure more protection for vulnerable communities, especially around access and access to affordable but also quality social services, even when they're in the hands of private actors. So I will hand on to Ashina. Ashina, you have 20 minutes. If you can do that in 15, it will be very good for us, catch up on time, but you have your 20 minutes to set the stage for giving us the scope, content, and objectives of the general comment. Ashina, over to you. Thank you.
Thank you so much, Arnold. Can you hear me well?
Yes, we can hear you very well. Thank you.
Okay, fantastic. I'll do my best to take 15 minutes. I'd really like to save time for the discussion at the end. That's usually a very critical part. So as you've heard, my name is Ashina Mtsumi. I work with the Global Initiative for Economic, Social and Cultural Rights, which was one of the several organizations that worked together together with the African Commission, specifically the Working Group on Economic, Social and Cultural Rights, to bring this general comment to fruition. I will very quickly give an overview. So my task, as Arnold has set it out, is very concise, to provide an overview of General Comment 7, specifically the objectives, the scope, and the content. It's a very comprehensive document. In fact, within GI, we've done a synthesis of legal provisions around social services for the different human rights bodies in the different regions. And the African region has the most comprehensive analysis and elaboration of state obligations with respect to social services and the role of the private sector. So we won't be able to get into each of the details within the content, but at least a flavor for each of you to be able to now delve into it yourself. Prof. Franz and Arnold have already touched on this a little bit by way of introduction. This General Comment 7 is not the first time that the African Commission is dealing with the issue of private actor involvement and the role of the state in the provision of social services. This general comment was adopted last year in July 2022 and then launched in October, but it was developed as a result of Resolution 434, which was adopted in March 2020. As Prof said, a lot of the development took place during COVID, on the need to develop norms on state obligations to regulate private actors in the provision of social services. So previously, the Commission, under Resolution 420, in their reviews of the states, particularly Kenya and Uganda around 2015 and 2016, and even way back in 2004, under the Pretoria Declaration, had already raised the alarm or expressed concern with the impacts of privatization of essential services. In particular, it raised the issue of increasing or entrenching discrimination and inequality in access to quality services, clawing back on transparency and accountability, and not enhancing the enjoyment of rights, especially economic, social, and cultural rights, when there's an increase in particularly unregulated private sector involvement, which was what was happening across a lot of the region. I know a lot of you are experts on this as you work on business and human rights, but just this is a brief background that led to the development of General Comment 7. So one of the objectives, as stated in the General Comment itself, is to support the realization of the AU Agenda 2063, which sets out to establish a more egalitarian or equal Africa founded on good governance, on democracy, on respect for human rights, on justice, and the rule of law. And you'll see that all of these elements really come out in the General Comment because, for instance, the services, social services, are essential for the enjoyment of certain rights. Some of them are recognized as rights themselves, for instance, the right to education, right to water. And there's really no way for us to move towards achieving this vision if we don't take seriously the universal provision of quality social services. So this General Comment is an effort for the African Commission to support states, to elaborate for states how they need to go about ensuring their social service systems are organized for the full enjoyment, for full access to these services, and therefore full enjoyment of human rights. It's basically to ensure that all the necessities of life are provided to all individuals, no matter the conditions of their birth. So this resonates with the concerns that were raised before around discrimination, around lack of transparency and accountability, and the need to correct that. In particular, the trend that had raised an alarm was that with the trend of privatization, states were sort of scaling down or scaling back their involvement in these sectors. So one limb of it was not directly providing or not increasing their provision of these services, for instance, education and healthcare. And there's a lot of reasons for this, including the structural adjustment programs, austerity measures where states were being compelled to shrink their budgets. And as one way to do that is to reduce how much they're investing in the direct provision of public services. And on the other hand, there was also the scaling down of their regulation of the sectors, of private actors in the sectors, because there's this market logic that was really infiltrating and taking hold of governance narratives, where the assumption is that markets can regulate themselves, accountability will be, people will vote with their feet. If they go to the school or they go to the hospital, then it's proof that it's good quality and it's doing well. Therefore, there's no need for the state to really interfere with too much regulation and oversight and monitoring. In fact, it creates a burden on the businesses and makes them inefficient. And this General Comment was an effort to really reaffirm and clarify the state's obligation that there is, in fact, an obligation to directly provide these services, including funding them through public resources, and to regulate, effectively regulate the private actors involved in these sectors. So it's also a decisive move to reverse this narrative or reverse this wave. On the scope of the General Comment, first on one practical point, it applies to all parties to the African Charter because it's an interpretation of the Charter itself. As Prof. Franz said, it's a soft law. So the main instrument, the hard instrument, is the African Charter on Human and People's Rights. And as an interpretive document of that charter, then this general comment will apply directly to the states that have already agreed to be bound by the charter. Fortunately, that's majority of the countries in the region. Secondly, in terms of the scope of the services, it states itself that it applies to a broad range of services, which can include anything from healthcare, water, education. So that's clearly including, but not limited to. It also emphasizes that under the charter, social services are recognized as education, food, healthcare, housing, social security, and water are not commodities for those who can afford them, but are human rights guaranteed to all. So under the African human rights framework, these are already rights that have been recognized, and therefore, and some of them are also services and are also essential for the enjoyment of rights. But one important thing to note in terms of the scope is that it's not a closed list. Because things can evolve, the interpretation of rights that are connected to services that rely on services for their enjoyment can evolve. For instance, as you've seen with the right to water, which wasn't included originally in the African Charter, but has since been recognized under the Pretoria Declaration, and now we have the guidelines on the right to water in Africa. So as the human rights framework continues to evolve, if there's any other things that will fall under this scope, the general comment would continue to apply. And to touch on the content, Arnold, please just give me a flag in case I'm running out of time, because this part, as I mentioned, is very comprehensive. So I'll just pick on a few of the elements. A lot of them you're already very well familiar with. But the first section within the general comment is on the general human rights standards applicable to social service provision. So there's things here like equality and non-discrimination, which are very clear, that there shouldn't be a situation where you can only access quality services if you can afford it, that everybody, regardless of conditions of birth, regardless of conditions in life, should be able to access quality services, that we shouldn't have a situation where maybe because of resources or because of geography where you are living, you're only able to access the services that are not of good quality. The other one, the first one there in the list, is non-commercial character of social services. So here the emphasis is that these services are rights or are intrinsically connected to the enjoyment of rights, and we cannot allow them to be left to the market. We cannot allow them to become commodities. So the question of, are we patients or are we customers? Or are we rights holders or are we clients? And it's really reaffirming that these are rights and the people are rights holders. And these services cannot be left to the market or become commercial or commodities, that they must be recognized as rights and organized and delivered with that in mind, that they're human rights that should be accessible to everyone. Connected to that is public services obligations and the collective interest in social services. For us to have cohesive societies, for us to have flourishing societies where everyone is able to live in dignity, where a service is being provided by a private actor, they must still recognize that they can't run it like any other business. If they have chosen to provide education, for example, they must recognize that this is a human right, first and foremost. It's essential for people's lives of dignity, and therefore they will be held to a higher standard. This is where the public services obligations come in. So states are urged to impose public service obligations where private actors choose to operate in these sectors. So one thing to note from there is that the general comment doesn't prohibit private actor involvement in these services. It just affirms that there must be higher standards, there must be a recognition that these are essential services and therefore cannot be operated like any other business. Again, thinking about the obligations of the state, we have progressive realization and temporal accountability. The general comment recognizes that while these are resource intensive and many times capacity is genuinely a challenge, many times as well, really it's a lack of political will and a commitment to follow through with establishing systems that work for the people. And there is a difference between a lack of capacity and a lack of will. And it's very important for states to demonstrate. Progressive realization shouldn't be viewed as an excuse for states to take their time, to not have concrete plans, because many times this is how it sort of plays out, especially in the countries that we live in. I'm in Nairobi in Kenya, and this is every time actors try to go to court, this is the first defense that the government will raise, that, well, it's progressive realization. We don't have to make sure that everybody right now is able to enjoy education. But what does that mean for the people who are at the moment not enjoying, not able to access quality services? And the general comment urges states out of their largesse, out of their relaxation, that this is not an excuse. Actually, progressive realization is an obligation to be taking steps, to have a clear plan with clear timelines, clear references to resources that demonstrate their commitment to take those steps towards the full enjoyment of the rights for everyone. And this is where the element of temporal accountability comes in, that we don't just wait until an undefined time in the future, that even now there is an obligation and can be held accountable for not fulfilling that obligation to take steps and plan right now. I'll move on to the next section. This is on the state's obligation to ensure the provision of public services. And this has two limbs. The first is the obligation to provide quality public social services directly. So this is connected to what I had mentioned earlier, where the state, it's to urge the state not to sit back and sort of leave the space to the private sector, leave the space to the market, that the state must very deliberately and directly provide these services. And this is a very practical consideration, because when left to the market, it's very clear that there are some areas where the business people will not go into. They won't go to remote areas, hard to reach areas. They'll try to avoid, for instance, investing in accessibility to ensure that there's no discrimination even for persons with disabilities to access the services. This is expensive. It will interfere with where there's a profit motive or with the bottom line. And therefore, the state must still invest and provide public social services directly. And connected to that is the obligation to fund public services. Under this, the general comment emphasizes first the importance of progressive taxation policies, the importance of addressing corruption, which is particularly relevant in our region, because many times I've heard this said, we say it a lot in Kenya, that it's not so much that we don't have the resources. It's first the allocation is not very good, but also a lot of resources are siphoned and end up in people's pockets. And it's important to emphasize that connected to the obligation to fund public services is the obligation to raise and then protect resources that can then be channeled towards strengthening public services or social services. Next is the state obligation to regulate private provision of social services. Again, this is to address some of the issues that we'd mentioned at the beginning of my presentation, where the state can't leave the space to the market and rely on market mechanisms to regulate themselves. There must be some minimum standards or some regulatory standards that are established, and not just established, they must also follow through with being able to monitor and evaluate and ensure that the companies are complying with the standards that have been set. Where there's a violation or an abuse, there must be means of getting redress, of holding the actors accountable, and that accountability will ultimately still rest with the state, even where it's a private provider who's delivering the service. So that's connected to enforcement and accountability, and of course, public participation, connected to the importance of democratic public control of these services, their connection to establishing societies that are harmonious, that are flourishing. Basically, that is the direction that this section is taking. There's also an important element there on safeguarding against regulatory capture. It's also something we see a lot in our countries, where there's a revolving door between government and the private sector, or there are people within government have an interest in the private sector that could sometimes create a conflict of interest that undermines effective regulation. And it's important for states to ensure that there are effective safeguards against this sort of capture that undermines efforts to effectively regulate. As we come to the end, I think this is my last slide. The conditions for delegation of, excuse me, public services. This, in simpler terms, addresses public-private partnerships. This has also really been advanced as a means of funding and delivering social services. This is still connected to the narrative that states, governments just don't have capacity. They don't have the resources. They don't have the people or the money, and therefore they must invite or partner with private sector to be able to deliver the services. But what we've seen, especially in the COVID pandemic, at the height of COVID, and Alana, who's coming to speak next, will really elaborate on this, is that the reverse is actually true. Public systems are much more resilient, public resources are much more resilient, and it's really one way of trying to move funds from the state to private actors, because they've seen that the state has a lot of money. If you partner with the state, you can access a lot of money, you can access a very big market. And it's important to therefore have very firm conditions to safeguard who can partner with the state. So again, it doesn't completely prohibit partnerships, but it does set a very high bar for consideration in terms of who the state can enter a partnership with, for what purposes, for what duration. And this is what's elaborated under different headings there: the substantive requirements, the procedural requirements, operational requirements, and then some actors being ineligible for delegation of public funding. So actors that cannot receive public funding. And an important thing to note here is the coherence of the development of the African Human Rights Framework, because you'll find similar conditions elaborated in the guidelines on the right to water, and also in the Abidjan Principles on the right to education. So there's a very coherent narrative and framework for how states should think through and consider partnerships with private sector, who they can. So for example, if it's a purely commercial entity, they're a business and their aim is to make a profit. They're not really looking to provide a service for the benefit of the users, for the enjoyment of rights, then this is something that could eliminate their eligibility to partner with the state. Finally, because the African Charter is unique in having responsibilities and obligations for actors other than the state, the general comment also elaborates on the human rights consequences for private actors under the African Charter. This is just to emphasize that businesses who would, or private actors in any other form who are delivering these services, also have responsibility to respect the Charter and human rights standards, and to be held accountable in the instances where they fail to do so. And same for intergovernmental actors, for example, the Africa Development Bank, as it's an entity made up of states and has a sway over the advice they give states, the conditionalities that they can impose on states as they give their loans and grants. It's important for them to also be cognizant of human rights standards, and to ensure that the decisions they take, the advice they give, is also aligned with maintaining human rights standards and realizing the rights under the Charter and flourishing for everyone. The final section is on reporting obligations, which is just as states develop their regular reports to the African Commission, there are certain elements that they need to report on connected to this general comment and to the social services and their full enjoyment of these rights. I'll stop there. Shukran, thank you all for your time and attention. I look forward to more discussion during the Q&A section. Back to you, Arnold. I'll just stop sharing my screen now.
Thank you very much, Ashina, for that overview of the objectives, but also the scope content, also the scope and content of the general comment. Like you said, I know it's a comprehensive analysis and very authoritative interpretation of existing human rights as you've laid out. I'm not going to pinpoint on a few of the things that you've mentioned because of time constraints, but I know as we dive deep into the practical implications of General Comment 7, we'll be touching on some of these of the content of the General Comment. Really key point, the non-commercial character of social services that we have to remind the participants, but also the conversations that we're having when it comes to state obligations. But at this point, I will turn to Alana. I know, yes, Alana has joined us. Alana will basically take us through a broader conversations around reclaiming public services, lessons learned from COVID-19, and why the general comment is timely. Because I know the conversation around this general comment has not yet started as far back as 2019, that was before COVID, and also the work in developing this general comment by the different partners happened, at the start of COVID, but also throughout COVID. But the important conversation is that COVID-19, in a way, showcased what the challenges, what kind of challenges that we are dealing with when it comes to private actors involved in provision of social services, and the implications of government laxity, if I may say, when it comes to social services, when it comes to key public services as health, education, water, electricity, and so many of these key components that were at the height of most people were largely affected, especially the vulnerable during COVID, because of the lack of government intervention when it comes to private provision of social services. So Alana, you're welcome to I don't know if you have a presentation, but you can dive in now and take us through that conversation around the lessons learned from COVID-19 and why the general comment was timely. Alana, over to you.
Yes, thank you. And I think I'll keep my video off because I had someone note that she could not hear, and I think a problem in African countries. But it's good I'm following Ashina. I think when this general comment process started, the situation was much better than it was today, in that people realized there was a lack of public services, but some of you in the middle class, you thought you could afford, you could afford healthcare or education. And then COVID-19 comes and turns everything upside down. In Uganda, for example, you need at least 20 million to deposit to be able to get a hospital bed. I remember even those of us who are in insurance, when our insurance provider told us, basically, when COVID comes, when you get COVID, we do these basic things, and then, sorry, we have limits. I remember I got so heated with the insurance provider. I was like, what's wrong with you? And they were like, no, it's a state's responsibility. I was like, oh, now you all recognize it's the state's responsibility. And I think now we are facing polycrises. I mean, there's been COVID-19, the cost of living crisis, and the inflation that's happening, and the UN itself was talking about a recession. The UN never talks about a recession, right? But it's really we are aware that a recession is imminent, and they think we still have some time to roll it back. I'm less optimistic, and so we have to then think about how are people able to cushion themselves in these very difficult times. And those of you who thought you had some money, you realize your medical bill away from poverty. Many people didn't make it back to school. I have, for example, someone working for me who should ideally be finishing up his high school. And that's because his parents was struggling before COVID-19, but at least they were getting by. And now this brilliant young man is out of school because COVID-19, destabilized a lot of people financially. And we're still, particularly African countries, we didn't have many buffers. Our economies didn't have many buffers. Most people are, in the informal sector, or just, you're on your own. So there was not much social protection there. And so we have a lot, ISIS data has found that a lot of kids are dropping out of school. The dropout rates are higher. And when it comes to healthcare, it's a similar tragic story. And I think what we've been trying to avoid is the idea that, you know, this is not anyone's, I think the challenge in many African countries is the idea that health or education is public services are your personal responsibility. So it's very normal to, you know, you want a road, you dig and make the road. You want electricity, you go buy the poles and everything, you know. You want a hospital, as a community, you mobilize and you set it up. And the rural areas where I've spent a lot of time the last couple of weeks is where you really see this. But what happens when the community can't, when they're barely able to get by? And I think it's about time that Africans woke up and reasserted that they have a right to these public services. And I think the general comment is it's fantastic with this regard, because it reiterates the state's responsibility. It's like it reminds the state, in case you have forgotten, the buck ends with you. But also, not any quack is supposed to be able to come and say they can set up a hospital or a school. Right now, the fight we've been having in Uganda, for example, is the fight about regulating school fees. I took government to court, and government began to act to regulate. And then the private actors were like, who are you? You cannot come and start regulating our school fees. And a lot of people said, well, we also come out of a cost of living crisis. We are saying this chart before you start raising fees, there's issues there. And also, you know, the government has always had the responsibility to regulate. You all remember the drama with Bridge International Academies, when government say people can't live, students can't live in these conditions. And there's been a court case agreeing that government has that mandate, and Bridge should close until it complies with government directives. And Bridge is still open today. So this idea that private actors are becoming, while they are supposed to come and complement the state, they sometimes, because they feel they're putting in their own money, which is not always the case, particularly public-private partnerships, but because they feel it's private money, they think they're above the law. And we saw this with you know, hospitals. This was across the African continent. And in countries like ours, where the government said, wait a minute, how are you coming up with these charges? They said, excuse me, hands off. It's a fight. It's still an ongoing fight. There's a lot of money on the table. And we also see the people who finance us, people like the World Bank, that are playing two sides. On the one hand, they say, according to their report, for example, I think it's from double shock to double recovery. Anyway, it talks about how governments need to spend double what they spent before the pandemic on healthcare. But at the same time, they go ahead and continue to push for this idea of public-private partnerships. I was recently on IMF4 where someone said, maybe we should have them. And someone said, yes, we can build the local government capacity. And I thought, have we learned nothing? And I think, you know, this general comment is really useful for those of us who litigate, but also who are mobilizing and saying that, can we get together as Africans and demand certain things? There is power in people coming together and demanding. You have the African Commission giving you this very useful document, you know, their principles, their whatever you want to call it, but the fight is only just beginning, right? And the fight has to take different forms: litigation, it has to take community organizing, mobilizing. We started a Reclaiming Public Services campaign. And some of the things that were really evident to us was how if you make enough noise, if only at your community level, certain things begin to change. And then how do you amplify all those demands to national, to regional levels in a way that is effective? How do you make sure that you're able to really utilize the eye-opening awakening that COVID-19 should have provided? Because the stories we attended, the African Commission had a high-level event, for example, on health and social protection in 2021. And as I sat in the room, the stories were just, it's like we're one country. It was delegates from the people from different African countries, but it literally felt like one country. Like it was the same stories: detaining of bodies, exorbitant fees in hospital. I mean, it was literally the same stories, lack of social protection. So how do we make sure then that we are holding our governments to book? And I think that that's partly why we're here today, to say that there are there may be different things that people have been doing, but how do we strengthen this collective voice? For those of you who have followed the climate discussions over the years, I remember like in 2012, 13, working on a principles for climate change, and no one was really, everyone was like, I don't think so. But there's a collective, just increasing steadfast demand. And now everyone, our own governments now are beginning, the Ministry of Finance are beginning to plan for, because it's here, right? People have been talking about this for decades and no one was taking it seriously. There was no right to an environment, and there was just a lot of things people are really playing around. And I think that public services, it's tricky because people like to act like if you demand public services, you're asking for handouts, yet you're not. And we are starting, at least, and we are human. The very least you can do for us is provide them. And what I love about the general comment, one of my favorite things, it tackles the financing aspects of it. In a lot of our advocacy and campaigning, the financing, like Ashina said, is where things get a bit murky. Everyone says progressive realization. They say we have no money. You can also see Russia, Ukraine. You can also see the cost of living crisis. If we give 15% to health and Abuja, then the 10% of Maputo, how do we, will be no money left? And yet it's just a false narrative. We've always pointed that out. When you say you need security, no one sits there and says there's no money left. They find the money for security, sometimes even with sham wars, right? I mean, at the African continent, that's what we do. So how do we make sure that we're able to say, no, you have money. You can, first of all, utilize the money you have effectively. You can widen your tax base. You can make sure that those who are not, those who are wealthy are paying their fair share of tax. And I think these things have to be connected. And because when you talk about regulating private actors, there's regulating them in social services, but also by making sure that multinationals are not evading tax, you're getting more money for public services. And so I think that any work we are collectively doing and reflecting around this must absolutely make the linkages. I know some people work just on, for example, corporate accountability, right? Where you focus a lot more on the private actor, and others who work, say, on healthcare or education. And I think it's time to really break through those silos and begin to have this discussion more fruitfully. And so besides the national and the last year we had an Africa meeting where we talked about, in Uganda we had already done an Enough is Enough manifesto, and this came about quite organically. I'm glad I'm seeing Dr. Luyirika on the call. I remember it was at the height of the Delta wave and people were just dropping dead because there was no oxygen in our public hospitals, and a number of us got together and called for an urgent meeting and began to say, this is nonsense. What do we want? And we came up with that manifesto. But last year as well, even before the general comment, I think, had come out officially, a number of us had begun to have these discussions. I know Ebenezer is not here and a couple of other people here about the Africa we want, and really thinking through the fact that it will be a double tragedy that my generation has not really seen functional public services, and then our children, maybe our grandchildren, are less likely to see them because of high debt, because of the government gradually abdicating its responsibility as a whole, and because entities like the World Bank are still, despite all that they know about PPPs, aggressively pushing for them. And so began to think through how do we amplify our voice and get it very squarely on our government's agenda. But last year we also, with a number of organizations, GI was one of them, we were in Chile, and this was very good to see how this is not just an issue in Africa. It's a very big issue in Latin America. It's a very big, just like across the world, everyone was talking a bit about why we must reclaim public services for a more just future. We know that with climate change, our economies are more prone to shocks. And of course, the cost of living crisis is more likely to bite when it comes, for example, if in the villages here, when the rains are late, it means it just messes up the harvesting of the beans. And most people sell beans to pay for their children's school fees. So, you know, their income is hit by climate change and there is no public school equivalent around, then it's just a double tragedy. So it was very interesting to be in Chile with activists and people, you know, academics and just union members from all across the world, and to see that this is a problem everywhere else. I still think, and there's a manifesto. Our feature is public. Please check it out. Please also join us on that.
Hello. Seem to have Alana. Are you still on?
But I think that particularly others, maybe they could. Yes, can you hear me? Hello, Arnold. Can anyone else not hear me? I can hear Arnold.
Yes, but no, we lost you for about 10 seconds, so we couldn't hear you, but you're back now, we can hear you.
Okay, great. I'll just wrap it up. I think that we should harness the opportunity provided us by two things, by COVID-19 and this cost of living crisis, but also by this general comment, because this general comment is reiterating state obligations on two issues that are very pertinent to public service.
Sorry, Alana, we can't hear you now.
I think it. Can you hear me now? I don't know what's happening.
You're breaking. I think there's a bit of intermittent breaking in your, kind of keep on breaking. Yeah, so we couldn't hear you very well. I don't know.
Yeah, no, it's okay. I think let me wrap up for a bit and then I'll try again when the connection is a bit stronger. But just to reiterate that it's a great opportunity for us right now.
Okay, no, thanks. Thank you very much, Alana. That was, a very good discussion, but also laying, the challenges that we witnessed with COVID, and also made me noting, how COVID exposed, the gaps and growing concern regarding rapid commercialization and some of the key conversations that were had at the head. And the unfortunate bit also that you touched on, there was a bit of conversation even during COVID that maybe our governments have learned something, but the budget allocations and everything that is coming on, you see that they have not really taken grasp of exactly the implications of lack of funding within, and you talked about lack of, increasing financing of public services, but also you get to see that the pandemic showed how vulnerability our systems, our public systems are, especially the public health, but also by extension education and access to other services, but also how the vulnerabilities these systems have, how profound the implications to many are, especially the vulnerable communities, but also those that cannot access or even afford reaching out to private services for access to health or even education. And I think it shows the linkages and the timeliness of this general comment, and hopefully, and maybe the hope that you put forward, we hoped that governments would have learned out of this. And maybe the big question you put, and I will end here before we take a quick break, before we go into the next panel, how do we then amplify? Because you also mentioned, you talked about these small wins, if I may say, or small local demands at ground level that different people have driven, or different movements that have been formed that drive and demand key services at local level. Then how do we amplify those local demands to national or even regional impact and effective implementation of this general comment? And I think that's something that we need to be thinking about as we grow momentum and broaden the platform around reclaiming public services, but also pushing for effective implementation of General Comment 7. If you have any questions, please, you can still post them in the chat, but also we'll open up, we'll have more time at the end to entertain questions, but also suggestions on how do we move forward. At this point, I know we've eaten into a lot of our time, okay, a bit of 10, 15 minutes, but let's take 5 minutes and be back at 5 minutes past 1 p.m. South African Standard Time to listen to the next panelist, who is Joseph Biomhanj, really looking at the corporate accountability angle of this conversation. So let's just take the 5 minutes of break, and then we'll be back at 5 minutes past 1 South African time, so that we go into that next section of our webinar. Thank you.
Hello.
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 Yes, hello.
Good afternoon from Nigeria.
Good
Can you hear me?
afternoon. Yes, we can hear you.
Okay. All right.
Okay, hello, participants, colleagues. We are going to resume after that short break, 5 minutes, and we'll try to get back the time lost in the first session. So the second session will be a bit shorter, and I might request our panelists to give their interventions probably in 15 minutes so that we can recover some time. So we've had that first conversation. For the participants just joining us, we've really had a broader overview of General Comment 7, looking at the scope, content, and the objectives. And then we had the second session on reclaiming public services, where Alana, guided the conversation in really looking at lessons from the COVID-19 pandemic and why this General Comment is timely and how we can use it, especially in furthering demand or strengthening our work with governments and different agencies around financing, increasing financing, but also reclaiming public services in our countries and communities. So this second part of the webinar, we are really going to have Joseph Byomhanji, who coordinates the Uganda Consortium on Corporate Accountability, and who will lead the conversation or the discussion on corporate accountability in the social service sector, the practical implications of General Comment 7 for private actors involved in provision of social services. Joseph, the floor is yours. Please take us through your discussion. If you can do it in 15 minutes, it will be very good for us. Thank you.
Thank you so much, Arnold. Good day to the participants on this webinar. I'm Joseph. I coordinate the Uganda Consortium on Corporate Accountability. I hope you can ably hear me loudly and clear. I'll be speaking to the practical implications of General Comment number 7 to private actors involved in social service delivery, and largely drawing on the case studies of health and education, picking it up from where Alana has left it, drawing from the COVID-19 experience. Did we learn any lessons? And emphasizing really the clarity that the General Comment makes with regards to the obligation of the state, but also where the private actors fall in this. For colleagues that have just joined us, we had Professor Franz open the webinar, and he spoke so much about the objective of this General Comment as he gave his remarks. So I'll pick it up from there, that the great task we have as the continent is to be able to create an egalitarian Africa, one that is free from issues of discrimination. And so the provision of social services is really very critical in achieving this goal for all African citizens to be able to universally access quality services when it comes to public services. So the greatest challenge to this journey in post-colonial Africa has really been at the stage where the Washington Consensus advised that governments need to pull back and let private actors take on this mantle of providing social services. And that has really been the case. The trend has grown so much recently, and currently over 50% of the African governments have entered into public-private partnerships with different private actors to provide social services. What this means is that you're combining the private and public. Most often the private actors, when they sit in their boardrooms, the goal is to get the maximum profit for the shareholders. But now they are choosing to come and invest in social services, services such as education, such as healthcare, transport, electricity, where they are seeking to obtain the highest profit available for the shareholders. And yet for us, we view them as human rights as enshrined in the African Charter. So the General Comment went in a long way to explain what exactly amounts to realizing these human rights, because social services are at the center stage of realizing human rights. I'll speak to largely 3 issues, and I'll start with the non-commercial character of social services that this General Comment emphasizes. Increasingly, the commercial interests in Africa are transforming social services into private commodities. So you find that essential services such as healthcare, education, housing, social security, access to water are all commodified because the shareholders out there that are investing in these sectors are looking out for the highest profit. But from the interpretation of the General Comment, it emphasizes that the African Charter provides these as rights, and social services such as education, food, healthcare, housing are not commodities for those who can afford them, but are human rights guaranteed for all. In our country, Uganda, we always had this debate that they should let issues of regulating school fees be determined by the market forces of demand and supply. Alana made mention of that the Initiative for Social and Economic Rights has been pushing in advocacy to have the government of Uganda regulate how much tuition and non-tuition fees each school is able to charge per learner. And policymakers, business actors involved in this sector were very quick to come out and object, saying that the government has no place in dealing with this. Now, the message to them is that the general comment, number 7, ably clarifies the obligation of the state when it comes to regulation of private actors that are providing social services. And as such, it should always be informed by the people managing these businesses to inform their shareholders that if they choose to invest in sectors where social services are, they should remember that they are non-commercial in character. And as such, if they are looking out for the maximum profit available, then they're in the wrong venture as a business entity. The second aspect I want to talk about is public service obligations and the collective interest in social services. That is really very important because it clarifies for all private actors what exactly they are getting into when they choose to provide social services. In our country, the discussion has always been that way before the state we know as Uganda got to be conceptualized, services such as healthcare and education are being provided by private actors through the Church Missionary Society and also the British East African Company, the Imperial British East African Company. But long after that, the state got formed, and post-independence, the government of Uganda took on the responsibility to provide social services. So it was until the Washington Consensus that came with numerous policies, including structure adjustment policies, that then advised governments to stop heavily investing in the provision of public services. And that inroad brought in private actors who came to make profit from the provision of these services. And one of the greatest emphasis the general comment makes is that public service obligations and collective interest in social services is what should be at the center of dealing with this. The provision of social services is inherently a public activity, that emphasis is made, which is critical for the enjoyment of the human rights. When we talk about education, it's a human right. When we talk about food, it's a human right. Healthcare is a human right. So the provision of social services is inherently a public activity that is critical for the enjoyment of human rights. So when a private actor chooses to participate in social service provision, they then choose to perform a core public function that demands a high level of protection of collective interest. This is all clarity from general comment number 7, in case people are still debating, viewing public services as any other business where they come in and want the market forces of demand and supply to determine how they go about their business, to determine the cost of services. This issue is clarified. So the overriding public interest requires the states, the African governments, to impose a range of public service obligations. And I want to read for us what public service obligations as interpreted by this general comment means. Public service obligations refer to a set of domestic norms and regulations that ensure that the state's international obligation to respect, protect, promote, and fulfill human rights is upheld, even when private actors may manage, control, or otherwise participate in the day-to-day aspects of social service provision. So, excuse me, that clarity that the general comment makes with regards to the public social obligation, public service obligations is what private actors seeking to invest in provision of social services need to know. And if they choose to continue with the investment, they need to know that they are coming on board to provide public services and it's not business as usual. They cannot let the market forces of demand and supply determine how they are going to go about with their business. Short of that, they should be able to invest in other ventures where the market forces of demand and supply would be able to determine the profit they take for their shareholders. In the interest of time, I'll keep it there. AFCHR made mention of several other aspects that I would have loved to hint on, especially the conditions where the states have to now partner with the private actors to provide social services, who gets to have access to the resources in the different consolidated funds to be able to provide social services when they're a private actor is something I wanted to largely talk about, but AFCHR made hint of it. So in the interest of time, I'll hold it here and looking forward to your engagement. Thank you.
Thank you very much, Joseph, and also thanks for delivering that presentation in the shortest possible time, because you have also bought us an extra 5 minutes to be able to catch up on the lost time. So I appreciate that, but we'll be able to touch a number of the issues that you've mentioned, especially when we are looking at that general discussions and exploring or having experiences shared or best practices, or how different civil society actors or even countries have dealt with the issues around private actors in social services and issues around access to remedies for corporate abuses in the sector. So we'll be able to turn to that during the general plenary or the general Q&A session later on, and we'll be also turning back to you to show more light on exactly what you at ACCHR or the different partners you work with at UCCA have attempted to approach this question. Our last panelist is Ms. Delphine Tosi, the Executive Director of Right to Education Initiative. So we'll turn to Delphine to really guide us or lead us into the conversation of how then do we use the general comment. There's a lot of, we have unpacked it, we have broken it down, we have shared the implications it has on the current realities, practical realities within health and education, but also the different social services that different actors are working on. But how then do we use the general comment to strengthen our CSO advocacy, but also enhance corporate accountability in our work? Because so many actors or so many stakeholders might be asking the question, it's a good platform, it's a good framework, it's good, the content is great, but then how do I use it in my day-to-day work? Delphine, over to you to lead this conversation. Thank you.
Thanks, Arnold, and thanks for bringing me into this conversation. So I'll be brief in terms of time, and I think it's important to talk about the use of this document because, of course, it's been developed with a lot of analysis. Research is a very solid and comprehensive document. And as AFCHR demonstrated, there are a lot of information there, and these have been developed because there is a need to be used. So we need to highlight a bit how this can be used. And first things to recall, of course, it's been asked to be developed to support the implementation of the African Charter. And so to guide, it provides a guide to clarify states' obligation and related rights for individual and for groups. And this one is this general comment and the topic on the right and state obligation regarding social services in the context of private provision is a really useful one, and this have been highlighted by the other panelists before. But it's respond and provide guidance and information on a new phenomena, and that capture what was not captured in the development of the Charter and the adoption of the Charter in 1981. So it's really the place to go, the document to go, the text to go when we are working on social services and related rights to the social services. So mainly when we talk about issue in Africa, but I think this text can be useful outside Africa and in other contexts. So I'm going to highlight that. And as this have been highlighted by AFCHR in the introduction, the text provide definition, it provides detailed explanation of states' obligation, a framework for regulation of private actors involved in social services provision. So there are a lot of information there that can be used for advocacy and other work to protect social services, to engage in discussion on this topic, and even for litigation and holding states accountable. So I'm going to highlight some example, direction, avenue to use them. Having in mind all the work we've been doing ourselves with other organizations on this panel, including GI, and on the Abidjan Principle on human rights obligation of states to provide public education and to regulate private involvement in education. So of course, this text was only on education, which is my area of expertise, but it's have been used a lot. And I think there are some inspiration as well for the General Comment 7. So one thing to be used is to expand awareness on this topic. And I always like how Alana, she talked passionately about this topic. It's a debated topic. It's a critical situation for all of us now on how public and social services are undermined. And this text, it brings a framework and a reference to discuss this topic, not just like in an ideological way, but referencing to states' obligation within the framework of African Charter. So it needs to be shared widely. People need to be aware of this text, but more on the context and what is inside and how this can support some discussion. So of course, I mean, it can be used for discussion, for debate. The media need to be aware of them, civil society organization, but at the ground level as well, you know, the people that are facing that as well at local and more local level, even school administration, parliaments, the one who are going to develop the law, they need to be aware of the detail of this text. And so there are a lot of things that can be done in terms of developing brief, communication document, even videos that make this more accessible. And as this general comment cover different social services and rights, there may be some, you know, short brief on specific rights or social services to really help and guide people who are dealing with a particular issue in their own context of work. This can include as well training and workshop to really unpack and understand what is behind this text, including event, a promotional event and radio show, for instance. That this is things that have been happening, for instance, with the Abidjan Principle. So this is one use, is making sure like it's unpacked, we communicate about it in a friendly, accessible way, unpacking and making some specific focus on some area and to different type of actors that may be involved on this topic. Another avenue is to use them to strengthen research. And I'm thinking, for instance, research like education. Sorry, I'm so focused on education, not necessarily on education, but any research like in development research, I mean, not necessarily on the legal framework, but on other disciplines that may look at social services, like how this can be strengthened with the reference to the general comments, like backing that with the state's obligation, because then this helps to make the research even more actionable for advocacy and even litigation work. So working with academics outside the field of law that can maybe use the general comment for making some reference and even developing some research question based on the framework of the general comment. So this can be very useful, and we've seen that develop with the Abidjan Principle that have been very helpful. Another avenue is social accountability, so through monitoring, reporting, and advocacy. So of course, like the reference within the general comment can be used for reporting to the African Commission, but it can be used as well at national level, not only at the regional level. It can be used at the national level and local level, as I said, in dialogue with policymakers on this area. And for instance, in the context of the adoption of a new law, or to call for the adoption of new law and regulation on this topic, but it can be used as well, like really to claim states to take action and to implement their obligation. So this more in a call and strong advocacy campaign, in letters that can be sent to government, to parliament, and really references what is there, like and calling them back to their own obligation. As I said, like it can be used in the African Commission context, and I think it was Alana who mentioned the African Development Bank. You know, it can be used beyond the African Commission and in other political and intergovernmental space within Africa, but I think outside Africa as well. I'm thinking of any reporting to the UN treaty bodies, even. Of course, the UN treaty bodies, they monitor the implementation of international law. It may be very useful to bring also the reference that have been developed at regional context when bringing case on an African country. And when we were talking about the African Development Bank, I think like the World Bank as well, who have so much impact on the development of social services in country and in our context in Africa. So I think like doing some campaign and advocacy when raising this issue, it will be very useful to refer to what have been developed at regional level and within the context of the African Charter. And I think, and this is to link as well with what Alana have been mentioning, the event that happened in Chile in last November, where it was an event, a global event talking about different type of public services. And I think this is really the added value of this general comment, is actually to talk about social services generally, like, you know, a diverse social services, not just one as the Abidjan principle, which are on education. This one covered different one. And we know everything is interconnected. So I think like to engage in space on this topic on social services, and maybe to inspire, get inspiration to in other regions to develop such framework. I mean, for me, Africa is leading the conversation on that. I mean, you are in the front line and leading this conversation. So I hope this can be used in other platforms and in Latin America and other places. And so engaging and bringing this conversation in other places and share what have been done in Africa may be very useful, I think, for a global conversation on this topic. And lastly, of course, it can be used for legal accountability, to use them as a reference in any submission bringing to the court. But the judge may use them directly as well without this being mentioning in submission. And we've seen that in some cases with the Abidjan principle, including in Uganda. And so, for instance, like training judge and making sure the judges are informed about the content of the general comment can be very useful, because it can help them to provide some arguments and guidance in their decision. And yes, I think it's what I wanted to highlight. I hope I didn't forget anything, but I really wish the best for the implementation of this general comment, which is already very helpful for our work. Thank you.
Thank you very much, Delphine, for that discussion, but also triggering our insights on exactly how we can use this general comment. I think it's been really, it's a lot of things, very comprehensive on it from a wide perspective on how we can use. But it may be, I know we have now 30 minutes left before the end of webinar, and we'll have a broader conversation. But touching on a few things that you've mentioned, which are really important, and even from the last bit of it, mentioning that Africa is leading this conversation, because we've developed this, we have this framework that we can actually, you know, amplify beyond the region, get other, you know, countries and regions that are facing the same challenges when it comes to private actors' involvement in social services to buy in, but also trigger more conversation from the UN level, as you've noted, and the different development partners or development financing institutions that are very key or at the heart of financing some of these private entities, but also strengthening regulatory and standard setting frameworks at national level. So it's really important from that angle, but also one of the other things that you mentioned, which I think is a huge point for us to take away, is using the general comment to expand our research at civil society level, but also at national level, because it's then important for that to inform our advocacy, but also to strengthen our credibility in the work we do. And the last bit of it, how we can use it for legal accountability, is also very important, because much as, and Prof. France mentioned it in the welcome remarks, it can be persuasive. It's a very important persuasive instrument, but if we engage with judicial partners, we engage with practitioners and train them and build their capacities around these principles that are highlighted within the general comment, then it can be an important tool and an effective tool to use in legal accountability or other judicial matters that we may face at civil society level. So I will leave it at that. Thanks again for that conversation. And now the last 30 minutes are really going to focus in this open conversation that we are going to have with participants. So if you have a question, please put your hand up, or you can put your question in the chat. I will be able to read it and direct it to anybody, but also even if it's a comment on the general comment or general comment 7 or specific question, please don't hesitate to ask that. So we will have about 20 minutes of Q&A before we close at exactly 2 p.m. South African Standard Time. So I have a hand up. Paul?
Yeah, good afternoon from Nigeria.
Yes, good afternoon.
Yeah, my name is Paul Odokra. I work with ANIJ. ANIJ is a national NGO based in Benin, Benin City, Nigeria, and works in the areas of environment, economic empowerment, human rights, and climate change. So the G7 comment captures succinctly what social services should be used for and what they should provide for the citizenry. But in Nigeria, where we are having a lot of challenges, especially economic challenges, you hear things like the government has no business in business. And as a result, government is trying to divest, go away from some critical social services that are very important for the masses, especially in the areas of education, healthcare, and energy. Right now, we have a very challenging issue, talking about fuel subsidy, which is going to be removed in the upcoming government. And the issue now is with this G7 comment, which talks about providing social services to the people as a right, as a human right. And now our government is going to remove this subsidy and is going to leave it up to private investors, whereby the citizen will be left at the mercy of investors who are primarily concerned with making huge profits and not about the welfare of the citizen. So how can we use these social services, this general comment, to impress our government to think back or to retrace its step in freely leaving the energy sector in the hands of investors who are not going to respect, or who are going to base it on forces of demand and supply. How can we use it as an advocacy, this general comment, to convince the government to make sure that the citizens are not exploited? Because they're going to remove subsidy and the citizens are going to feel the negative impact in terms of inflation and hardship in transportation and energy supply. Thank you.
Thank you very much, Paul. for the broader comment, but also the key question. I know part of it was in a way answered by Delphine, but I will also open up to other panelists if they have something to say. Any other question? We can take more questions before we turn back to the panelists to give answers. Is there any other question? Let me check from the chat room. We don't have any question. Maybe as other participants decide if they have any questions. I don't know who of the panelists would like to respond to Paul. He questions how do they use, he highlighted a few of the challenges they are facing in Nigeria, but also the government's move to remove subsidies within the energy and transportation sector, which is key in the country, but also poses the question, the government in Nigeria really has taken the route that government has no business in business, but also unpacking some of the conversation that we've had. Can we categorize health, education, water, electricity, these social services that are at the heart of this general comment, but also heart of this discussion? Can we categorize them as business to fall under that? Maybe we can, I can call on Joseph or Ashina, Delphine, who wants to give a response to Paul. I don't know, is Alana still online?
Yes, I am.
I don't know if you had Paul's question.
Paul's question, and I thought I got a bit confused because on the one hand, I had him asking about subsidies, and how the cutback on subsidies would affect, like what, just the fact that it's like, it feels like quite abrupt to the citizens, right? I don't know if I got you right, Paul. Could you please clarify if I answer?
He talked about the government has intention to cut out the subsidies they give within the energy and transport sector. So then it would be left directly within private actors. But also the challenges, the impact.
Well, you mean the, maybe I know, did Paul mean the fuel subsidies?
Hello? Yes.
Hello, yes.
Yes, what I mean is government is going to remove its hands in energy, subsidizing energy for the citizens. It's not going to throw it open to greedy investors who are going to see it in the angle of profiteering at the expense of the citizens. Because once subsidy is removed in Nigeria and we don't have adequate transportation network in Nigeria, it will leave the citizens vulnerable to extortion by greedy investors who are not properly regulated by our laws, by our weak laws, so to say.
Okay, so it's you use the word energy by getting, because when you first said, I was thinking of electricity, then I was like, wait, is it fuel subsidies? And I think for me, my answer I'd categorize in two ways. I think for the discussion around, there are things that I think, and I know during the general comment process, the African Commission struggled with this, around areas like electricity, right? Where our states, I think, have really failed to take up their role and have drank the Kool-Aid of saying, sorry, just leave, and they don't realize the linkage between, for example, electricity and healthcare, where it's more clear in their minds why they must intervene, or electricity and education, or just it as a public service. And I think that's what this general comment is. It's good because it does not go into it doesn't always go into the specifics of each public service, but reiterates this general responsibility for the most part. I think that's really useful. I think what you clarify, what you highlight is something that you should be writing and putting out there a bit more. I know the discussion around fuel subsidies has been heated because the IMF, for example, has always said no, it's problematic, and people have talked about, are you subsidizing fossil fuel energy and therefore bad for the environment? The government is just stepping back, and that's to leave this for you guys to figure out. We have enough problems on our own. I think that's a very problematic and typical African leaders' attitude. And I've noticed that I think when people push hard enough, they can get their governments to act on certain things. I think Nigeria definitely could. So maybe it's getting that public outcry there, getting the media to talk about the human impact of it. Because sometimes it seems something can seem good at policy level and may have a jarring human impact, but it would also be useful to get more of the specifics, like I say, just the distinction between, is it like fuel subsidy you know, use, you know, the energy. When you think about energy, I think about like the electricity sector and other places as well.
Okay, no, thanks, Alana. There is a comment from Jean Donald. He
Sorry,
says,
Arnold, may I add one thing?
yes, please go ahead before I read the comment. It's fine.
Yeah, I completely agree with Alana, and I think between what she said and what Delphine have said, there's a lot of ideas there. I'm also thinking about, so we have a similar situation in Kenya where there's a lot of pressure for PPPs and privatization in several sectors, healthcare, water. And when you engage with the leaders, the ones who understand and would want to agree with our position say, but our hands are tied because this pressure is coming from beyond, in talking about the IMF and the World Bank. So I think as you think about the advocacy that you're doing, it would also be important to think about how you can directly address and challenge the World Bank and the IMF, because giving advice that will lead to violations of rights or giving conditions that will lead to the violation of rights is problematic, and they should be challenged on this. And then even governments, the pressure can ease on the government.
Yeah, I agree with you.
Okay, no, thanks, Ashina, for that, and Alana for taking on that question. But also, like I said, I think there's a lot to unpack when it comes to some of these critical areas or services. Like I was noting, a comment within the chat, Jean Donald says, on our side as Rwanda, the government is trying to increase public services such as schools, health centers, etc. But the problem is that these activities do not last long because some people, leaders, are involved in bribery or corruption in the market. And these public services continue to defraud the people because we pay it in different ways. I don't know, Jean Donald, would you want to shed more light on that? Any other question from the participants?
Thank you so much, and thank you everyone. So, as I said, the government tried to put an effort to make the public services available for the peoples, but the problem is still you have to pay. At the end, you found that is not, as many my colleagues said, it comes something that you have to pay. It will not comes like public services, as we have said. So they build the school, but at the end, you see, you're supposed to pay some amount of money to come. For example, for the health sectors, but when you are going to the hospital, you have to have francs to get services from there. So it seems that it is not a public service, why it was started like a public service. Another question is that because in the market, there is a corruption there. So if you may find a school which has no last 5 years, to start giving the sign that is going to despair when there's coming those question of climate change, the things like that. So thank you. Okay, no, thank you, Donald. But I think, yeah, it's some of the things that even the small public, let's say public education that is given, where you find it's just the bare minimum that cannot afford anybody, or even cannot afford the teachers, the capacity, or even the ability to teach because of lack of key essentials. And then they turn on demand on requiring parents or even the people that have to access that service. It could be at, you know, for the education, the schools. But then for hospitals, it's like so many times when people go to public hospitals and they get diagnosis and then they are referred to pay for all kinds of things, from drugs to you know, buying medicine or injections, to like all they do is maybe diagnose you with a problem and then you have to buy everything that you need. So I think some of these key issues are already evident in so many of our economies,
that are providing the basic public good or public service, but then you have to, the out-of-pocket costs make it nearly impossible to access any meaningful service from there. Ashina, I see your hand up. You can come in.
Thanks, Arnold. I really like this point because it speaks to something really critical, but it can be subtle when we talk about commercialization. And it's not only when private commercial actors come into the space and they now shift, there's more commercial actors operating in a market-driven way. As he's described, in many of our countries, there's commercialization happening even in the public sector. The other day in Kenya, we had a minister saying universities are not profitable, so we should just sell them off to the private sector. And that's a very problematic logic. Education is not supposed to be profitable in that sense. It has many other functions, including the full development of the learner. So there's a really important need, and the general comment can be helpful for this in shifting how even the public sector, public authorities think about these services, that they also need to not think about them as in commercial terms, but see them as rights, as enablers for rights, and therefore their function is primarily to facilitate the enjoyment of rights and living in dignity. It's the same thing when you see hospitals, public hospitals also detaining patients who can't pay. First, it's a problem that they must be charged fees, but then that you make the fees so important that this person will be detained or a loved one's body will be detained because they can't complete the payment. There's a whole mind shift that needs to happen in how our leaders think about social services, even for the public sector, and then for how they regulate private sector.
Yeah, no, you're right. Thank you for really bringing that important point across, because I think the commercialization of these public services is something that we rarely attach to the government, even when they are government run, because that example of the universities in Kenya, but also we have had conversations where I think there was a time where the National Water and Sewage Corporation was like the most profitable, like every year in its report to Parliament here continuously looks at or presents the profits they made each year. And the conversation was, should the National Water and Sewage, the National Water Board be making profits when so many people within the country cannot access clean water? Like their number one role or mandate or goal objectives to ensure that there is access to clean water reaches everybody. So you have less than 60%, or let's say half the population in the country doesn't have access to clean water, and they're relying less on boreholes and wells and stuff. And then you pride that every year you present that you've made such and such profits, because then you're looking at some of these institutions or parastatal bodies as business entities that are there to make money. And that ties in the conversation, Ashina, you're making about, public universities or public education institutions supposed to be making profits, or they are supposed to ensure that they provide access to quality education for all those, for majority poor that cannot have access to private institutions or the others. And I think that is a good conversation that should be touched or tied into the broader discussion around commercialization of public goods or public services, or looking at them at commodities, because also we're having it alive within the already existing public services that are still in the hands of governments or government entities. Any other question or point or comment to make? We have probably 5 minutes. Probably I will turn to the panelists. If there are no more questions, I will turn to the panelists to give their parting shots, but also call for action. Where do we go from here? This has been the first conversation that we've had, unpacking the general comment, but also linking it to the practical realities on the continent. How do we move forward? What is the takeaway from this conversation, and how do we strengthen this movement of actors working around reclaiming public services, strengthening existing services, but also ensuring or working towards effective implementation of General Comment 7 state obligations as when it comes to private actors providing social services. Let me start with Joseph, your parting shots.
Thank you so much, Arnold and colleagues, for the discussion subsequent to my presentation. My parting shot would be on twofold, looking at the part of the state, but also private actors. As colleagues in the civil society, the general comment presents us an opportunity that will result from popularizing it. Once it's popularized, it will go a long way in shifting the mindset of policymakers, such as those Ashina has shared about, who think that public universities should be making profit. And if it's not, then it should be privatized. They'll understand the coexistence of the state is in the provision of these services, but also to the private actors that are coming in to invest in provision of social services. They'll understand that the provision of social services is not ordinary business where the market forces of demand take the day. They'll understand that provision of public services is at the heart of the realization of human rights, because education, healthcare, food, access to clean water are rights that are guaranteed in the African Charter. So going forward, let us popularize the general comment across board and use it as a tool of advocacy to shift mindsets. Thank you, Arnold, and colleagues on the call.
Thank you very much, Joseph. Delphine, your parting shots.
Yeah, I think in short, I would say like how social services are undermined and at risk at the moment worldwide is really critical. And I think like keeping on protecting economic, social, and cultural rights is really a major challenge at the moment. So I think we should not give up. And I was just listening Ashina talking about what's happened now in Kenya in higher education. I mean, it's a huge struggle. And I really do think this type of document as a general comment is a tool for us to keep on claiming and advocating for the respect of economic, social, and cultural rights, and for the protection of social services for the future of this world and humanity, and especially the most marginalized groups. So I would say like, keep on using, like, let's use this document and keep on raising our voice and standing up for the protection of social services. Thank you.
Thank you. Yeah, thank you very much, Delphine. Alana?
Yeah, I think we need to mobilize. It was really interesting for me to just hear, so for example, Rwanda, when it comes to healthcare, our Ministry of Health tries to look at Rwanda, right? And people always say, look, this is the way to go. And they're still facing that barrier around fees for access, and around the fact that you still have to pay. It's just in a different way. There's insurance, mosquito, and all those things. And I think it's great to have that cross-continental learning. And I was thinking we need to do some more of these cross-continental, things, whether it's documentation or speaking. And I think, it's tough to mobilize in Africa, because you won't be like, sometimes you march, but you take a risk when you go to the streets. But in Uganda, there was this, there's been this interesting pothole exhibition this week that got the president to address the state of potholes. And he said, we're going to bombard with this hashtag, the actual state of our roads, right? No one went to any streets. And I don't know if that will work yet, but I think we need to just be more intentional about flagging, just the issues of public services in different African states, and maybe collectively working together. Because if, for example, Nigeria is having this issue, and if it's tied to public services, and you're highlighting, and maybe having a brief or whatever, then we come in to sort of, amplify your voice, to get the media involved. So there's a lot that has to be done. And I think, the general comment, I particularly love this section, which we didn't call it, it's not public-private partnership, but it really talks about when the state delegates, and reminds the state you're merely delegating. You don't get to say, sorry, the private actor now does this, or no, at all times you retain responsibility for this. And they're very stringent conditions. And all these forms of delegation are not supposed to be long-lasting solutions. They're supposed to be temporary because, you know, as the state builds its capacity, so I think we need to begin to highlight that area, because it's really that area around PPPs is increasingly taking shape, because, you know, they keep changing the terms. When we call PPPs privatization, they switched, you know, to something else that is sexier. But I think we need to attack it at its onset and look out and see the extent to which World Bank, IMF, and a lot of our other, you know, just generally the DFIs, how the extent to which their funds are coming with maybe soft conditionalities around this, and to mobilize around that, because like Ashina said, the commercialization, it comes so slowly, you barely notice it's there. It's the reason why, for example, in Uganda, the Cancer Institute, you're paying fees. There's a fee-paying wing. Like, wait, what? Why? You know, that's how gradual it comes. And someone says, we have to balance the books. We have to get the money from the wealthy so that we can provide drugs to the poor. Except the poor never get the drugs in that when you introduce that. So I think we need to just be now a lot more aware. I think we have been very good at pointing out our government's failures with regard to public services. You know, our public facilities not having drugs, or schools not having sitting spaces and desks. But now we have to also really interrogate a lot more the PPPs and this gradual commercialization, and to name and shame, and who is the beneficiary, and is there even corruption tied to it? We've seen with Lubowa Specialized Hospital in Uganda, it was a sham. We knew it was a sham. I used to run the court. But over the years, what has come out has shocked even us who litigated against government. So I think there's a lot of advocacy that we can do, where we name and shame, but also, you know, remind the state, and also work with states to remind them of their responsibilities. AFCHRs are always a tricky issue. You know, if you think about like even people who give legal advice to the government, they just don't, right? They don't think of AFCHRs as a legal thing. It's now that they're beginning, Ministry of Health, what have you done? We need a response to this. But if they did, they would be advising government maybe a bit more differently. So we need to reach out to the different arms of government in disseminating this. Okay, no, thank you. Thank you very much, Alana, for those remarks. There is a point also, a comment within the chat from Moropa. Privatization of parastatals and government institutions such as universities carries unforeseen and far-reaching consequences. I agree, as really noted by Ashina. And at this point, I think we do have a few, maybe 1 minute, Ashina, for your parting shots. Then we can hear from Liz to close the webinar.
Thanks, Arnold. I'll keep it short because I agree with what all of the other panelists have already shared. Social services are so central to people living lives of dignity, but also transformation in our societies. And the general comment is a very transformative document. It's really not an exaggeration when we say that it is the most comprehensive, but also the most progressive interpretation of these standards in the world. So it's really urgent for us to familiarize ourselves with it, ensure other people are also familiar with it, and then to use it, because it has a lot of transformative potential that we should tap into.
Okay. Thank you very much, Ashina. Thank you, Alana. Thanks, Delphine. Thanks, Joseph, for guiding and leading us into this conversation, unpacking the general comment, but also sharing experiences in the work you do, which is really highlighting the practical realities that we are dealing with on the continent. We have 2 minutes to close, and we'll be able to close exactly at 2 p.m. South African time. So at this point, let me request Liz to literally give us our closing remarks, but also, you know, why this was important, tying it into the ACCA General Assembly and the ACCA conference that will dive deeper into this over 2 days later on in the year. Liz, your parting closing remarks in 2 minutes as we close.
Thank you, Arnold. Thank you to all the participants. And special thanks go to the Center for Human Rights for the great collaboration, to the Initiative for Social and Economic Rights, to the Right to Education Initiative, and to the Global Initiative for Economic and Social and Cultural Rights. We thank you so much for the time in preparing this amazing webinar. We thank all the participants who stayed from the beginning to the end. This webinar is actually the first discussion we're having leading to the conference that we'll have in August on the sidelines of the ACCA 9th General Assembly that is taking place in Uganda. The conference will be actually will be focusing on regulating privatization of social services. So we will share the invites and all the details on our socials, in our networks, listserv, and we hope that most of you who participated will be able to attend. So we thank you all for the time, and we hope that you'll be able to continue advocating for this amazing topic. So we thank you all, and we hope you have a great afternoon. Thank you so much. More details will follow about the General Assembly, but it's basically in the last week of August 2023. Thank you.
Thank you very much. And that marks the end of our webinar. Appreciate everybody's attendance. We had a big number and continuous participation. Thank you. Have a nice evening, a good morning, wherever you are. Goodbye.
Thank you. Bye.
Okay, bye.
Thank you. Bye, everyone.
Bye.